Hi, I'm Jason Bourne. Welcome to another Follow Me Friday. And today we're here with Tim Melton with Integrated Pain Associates. And we have a few questions to ask him today. So can you tell us why people come to a chiropractic office?
Yeah, there's a lot of reasons. Most common is going to be just general like back or neck pain. So say you're doing something on the weekend, you're raking your lawn, picking up leaves, something like that. Well, when we're doing a lot of forward bending at the waist, that tends to irritate our low back. When we irritate our low back, that causes inflammation, which causes pain, which causes you to need to come see somebody like myself.
Okay.
And what we do in chiropractic is we just help the back move the way the back is supposed to move so you can feel better.
Okay, cool. And what made you want to open an office in Abilene?
Well, Abilene is my home. I was born here, but I grew up here, went to high school and junior high here. I went to graduate college at Texas Tech, and then I went to chiropractic college in Dallas. So after living away for about 8-10 years, I knew I didn't want to raise kids in a different big city, so Abilene made sense.
Okay.
I love Abilene, good people, big enough, but not too small, not too big, and again, it's home, so
Yes, sir.
it's a natural
Gotcha.
place for me to come
Yeah, that's
back.
awesome. So what made you want to become a chiropractor?
Well, I originally wanted to go to optometry school, eye doctor school, and started having second thoughts about that when I was at Tech, and I was thinking either going to med school or PT school. So my father-in-law was a chiropractor at the time, and he talked to me about going to chiropractic school, and I came and followed him, saw how it did, and it was kind of a good balance of both of what I wanted. So I get to interact with patients, I get to help them with their care, I get to get them out of pain, and it's just a perfect fit for me.
Awesome. So when people come to a chiropractic office, what's some things that they can expect, like with the whole process?
Well, let's just go back to your scenario. If you were doing some things on the weekend, you hurt your low back. Well, depending on your symptoms, when you come in, we're going to for sure do an examination to see exactly what's going on, what's the most irritated and why. Depending on the severity, if it's real bad, we may have to take x-rays. So if we did that, we would take some x-rays, we would go over them together here, and I would show you what's going on, what's wrong, and we would try to address those problems. So once we get done with that, like I said, we examine the back, we see what's going on, then we do whatever treatments we feel necessary, and then we go from there. Typically I'll do a treatment the first day. I'm a big fan of ice. Ice is an anti-inflammatory, it helps with back pain. So I usually have the patients use some ice, give them some stretches and things to do in the mornings to help out, and just a few things like that to help the healing process.
Okay, awesome. So you would say benefits of coming to a chiropractor are like less pain, and how does that affect you like in your normal day-to-day life?
Well, the big thing is nearly all the nerves in your body come from the spine and go elsewhere. All of them. I mean, there's a few that come in the brain, but nearly all of them come from the spine. So if your spine is having problems, you can have trouble wherever those nerves travel.
Okay.
So you hear people talk about like sciatica. Well, that just means I've irritated a nerve in my back that travels down into my leg.
Okay.
But the nerves in your spine also control your organs, your heart, your everything.
Okay,
So
cool.
if you're having spine issues, you can have all kinds of issues. So good spine health makes us feel a whole lot better, makes us happier, and that's what I like.
Yeah, awesome. So when patients come and they get adjusted, is that a painful process, or is it more like...
No, it's not painful. Let's just say hypothetically your back hurts. If it's hurting real bad, I can't really touch your back without it hurting a little bit. So is it going to be really comfortable to get it up worked on that day? Maybe not, but it's not going to be, you're not going to be in tears or anything.
Yeah.
So if your knee hurts and I touch your hurt knee, it doesn't feel good to touch it. So in order to work on your back, I've got to touch your back. So it doesn't always feel wonderful if we're hurting real bad, but you're going to feel better soon.
Okay, yeah, for sure. And so how many treatments would be typical, like if you have like pain somewhere?
Well, it's hard to say because no two of us are the same, but nowadays, like computer work causes neck pain. So if somebody comes in and they say, I was doing some stuff this weekend and my neck hurts, typically I could do it a time or two and you're going to be fine. However, if you've been shoveling gravel for 20 years and your back's hurt for 10 years, I can't say that I'm going to do it once or twice or 3 times and make you feel better. So
yeah, definitely.
It's a little tougher of a scenario, but there's no given person with neck pain 3 treatments. Everybody's different. If a 15-year-old's going to heal quicker than I am, I'm going to heal quicker than an 80-year-old. So there's no exact protocol for that. It's just you get people better, you see how long it takes. But I would say for your average, you're not dying in pain 2 or 3 visits.
Okay, gotcha. Saying, so if, like, how long would be in between each visit?
Again, depending on how bad you're hurting, but if I see somebody today, they're hurting pretty good, I'm going to see them in a couple days. If I see somebody that's like I said, just working on the computer this weekend, then I would see them today, maybe see them 4 to 5 days to a week down the road just to make sure all is well, and then we'd be done. And sometimes, depending on the person, I'll have them, well, some people just want to come and get a little tune-up every so often. What I mean by that, it's kind of like if you're walking every day to stay in shape. Well, if you have a history of having back pain, we work on you and we get you better. Our lifestyle is what causes us to have back pain, so typically our lifestyle doesn't change. So some of those people, like say the shoveling gravel guy, they may want to come back every month or 2 to try to maintain what we've done. Okay. Not everybody does that, but some people do.
For sure. And so you obviously treat like older people, but do you do children as well? Okay.
Yeah. Saying was taught to me is if you're old enough to have a spine, you're old enough to get a treatment. And now, granted, babies and things, I do treat babies, but it's not like they come in and tell me they're hurting. It's like colicky babies sometimes can benefit from this. Babies that are having a lot of ear infections can benefit from getting an adjustment, and they don't need the same amount of adjustments as we were talking about before. But like if I see a baby, I may see them one time. So it's a little different. They don't have the same stresses on their body that we do.
Okay, awesome. Tim, well, I think that's all the questions we have. Thank you for your time.
All right, appreciate it.
When your home needs to sell, pick the price.